Hello and welcome back to Unacademy. So let's crack NEET PG. Myself, Dr. Muskan Chaudhary, and we'll just do a short session of the question answer round for the disinfection. As we know that the Unacademy is the India's largest learning platform where you can access both the live and the recorded sessions, and that to learn from the India's topmost educators and from any of the medical exam. And you personalize your favorite teacher and follow your favorite educators, and you can test your preparation, can compete in the live T&Ds and test your preparation with the highly competitive quizzes, study on the device wherever whenever you feel live, and can assess up to 25,000 of the MCQs. So printed and the digital notes will be available, and these are being provided by the Unacademy. Now, iconic subscriptions is provided where Unacademy and the PrepLadder has come together with the Unacademy, and you can get clinical and integrated essentials with the video lectures from the Dream Team and the rapid revision notes with the Treasure and the Dream Notes with well-structured live batch courses, recorded classes, QBanks up to 25,000 of the MCQs, and the competitive T&Ds with comprehensive and the printed digital notes. FMG batches are being started where it is a 2 month course for about the FMG series and to cover all the 19 subjects until the December examination, and so is INICET to cover 1 month syllabus within for the 19 subjects to get you orientation for the examination. And the NEET PG, it's a 6 month program for the NEET PG examination for the next year with clinical cases and instruments and the integration. Live T&Ds with the top educators, live interactive classes, clinical orientation with the recorded version, and the PDF notes are available with the grand test series and the structured batch. Now, raise a hand is a feature that is being provided by the Unacademy where you can personalize your interactive live experience with quizzes, vivas, and doubt solving learners and one on one discussion with your favorite educators. With 12-month subscriptions, you get 2 months totally free, and with 24 months, you get 4 months totally free. 4 year subscriptions is mainly for the second and third year students so that they can actually start their preparation from starting with the clearing out their basic concepts with the Unacademy. Now there has been a little hike for the 12 months. It's around 52K for the iconic subscriptions, and for 18 months, it's around 57,500. For 2 years, it is around 65,000. For 3 years, it's around 75,000, and for 4 years, it's around 85,000. Please do use my code, that is Muskan10, to get what? To get 10% of the discount. It will be simply a question answer round. That is, the first we'll start with the question, and we'll get around 20 to 30 seconds for each of the question. Now, starting with what is the best method of the serum sterilization? What is the best method of the serum sterilization? Okay, this is the filtration, autoclave, radiation, or the heating. So, what is the best method of the serum sterilization? Very easy answer a question that what is the best method of the serum sterilization? This is what? This is filtration. This is what? This is what? Filtration. Filtration. ठीक है, filtration is used for the sterilization of the serum containing media, for the sera containing media, for the vaccines media, for the vaccines. Alright, so we use filtration because autoclave the temperature is very high from 121 to 134 degrees Celsius. So for the radiation we use ionizing and non-ionizing radiation and the heating technique. Also radiation can be used, but when we talk about the what is the best method, the best method is what? Filtration. For the filtration, for the sera containing media, for the vaccines, for the toxins, and for the antibiotics. For the antibiotics. Coming to the next question, heating at 63 degrees Celsius for 30 minutes will doesn't kill the prions, coxella, TB, or the spores. So, what is that? What are we are talking about? We are talking about the pasteurization method, and it is a technique of less than 100 degrees Celsius temperature. जिसमें one is the holders method, एक होता है flash method, and ultra high temperature pasteurization method. So what is 63 degrees Celsius temperature? 63 degrees Celsius 343, that is for 30 minutes is what holding the temperature. Flash for 72 degrees Celsius for 20 seconds and do the rapid cooling. Ultra high, that is 134 degrees Celsius only for the 2 seconds. Flash 72242, that is for 20 seconds. And it is not used for, it cannot sterilize the prions, coxilla as well as the spores. So what? Coming to the next question, tyndallization is a type of what? Intermittent sterilization, boiling, pasteurization, or the autoclave. Take your 30 seconds and let me know the answer. What is a tyndallization is a type of what method? So tyndallization is a type of intermittent heating technique. ठीक है, क्योंकि tyndallization is what 100 degree Celsius temperature we keep and for 3 consecutive days each on 20 minutes. हर दिन हम 20 minutes heat करेंगे intermittently and at 100 degrees Celsius. At 100 degrees Celsius, similar to this is one is the incipation method, जिसमें अपन टेम्परेचर 83 डिग्री सेल्सियस टेम्परेचर रखते हैं, दैट इज लेस देन 100 डिग्री सेल्सियस टेम्परेचर we use, and we mainly use for 2L media, that is what low flow serum slope media and LJ media. ठीक है, because autoclave cannot be used for the 2L media because of high heat, high temperature. ठीक है, so it is what intermittent sterilization technique. Alright, coming to the next question. Brownies tube is used as an indicator for the efficacy of heat sterilization, chemical sterilization, filtration, or the UV rays. All the UV rays. So Brownies tube is an indicator for which of the following? Just take your 30 seconds and just let me know the answer. So Brownies tube is used for indicator of for the efficacy of what? Now Brownies tube is a method of the chemical indicator, and it is what to see the efficacy of the heat sterilization technique. बी इट बी इट ऑटोक्लेव, चाहे तो वो ऑटोक्लेव हो या फिर क्या हो, हॉट एयर ओवन हो, hot air oven हो. The tube will change color from red to green in case of appropriate sterilization. So it is to see the efficacy of the heat, and itself is a chemical method. Okay, so Brownies tube is a small glass tube that is having heat sensitive dye, and it is used as a chemical indicator. The dye changes color from red to green. Okay, and it was discovered by whom? It was discovered by whom? Albert Brownie, after which the name is kept. Okay, now Which of the following is used to test the efficacy of the sterilization in the autoclave? It's a Clostridium tetani, Stereothermophilus, Bacillus pumilus, or the Cereus. So, which of the following is used to test the efficacy? Now, just take your 30 seconds. Which of the following is used to see the efficacy of the sterilization in the autoclave? So, which of the following is used to test the efficacy of sterilization in the autoclave? जो अपन बात करते हैं autoclave की, the biological indicator that we use, the biological indicator that we use is what? Is what? Bacillus Stereothermophilus. Stereothermophilus. Okay. Bacillus Stereothermophilus is also the biological indicator for plasma sterilization. For plasma sterilization technique as well. Okay, that is the Bacillus stereothermophilus. Now, Clostridium tetani and the Bacillus subtilis or atrophius is an indicator for the hot air oven. Hot air oven, and the Bacillus pumilus for the radiation. For the radiation. All right. Now, moving to the next question. Spore of which of the bacteria is used to sterilization of the plasma sterilization is the subtilis, pumilus, tetani, or the stereothermophilus. So, what is the biological indicator for the plasma sterilization? So, take your time and just let me know the answer. So, which of the following is used for the sterilization control of the plasma sterile? We just read it's Bacillus stereothermophilus. Clostridium tetanus spots are used for the sterilization of the hot air oven. इसके अलावा Bacillus subtilis और Bacillus atrophius ठीक है Bacillus pumilus for the radiation. Now coming to the next question, what is the condition required for the autoclave? It is 121 for 20 minutes, 121 temperature for 50 minutes, or 100 temperature for 60 minutes, or 100 temperature for 90 minutes. So what is the condition for required for the autoclave? So what is the condition that is required for the autoclave? When we talk about the autoclave, ये क्या होता है? Steam sterilizer होता है. Steam sterilizer, that is what? Wet, moist heat technique. Moist heat technique. ठीक है? It is a technique of what? Moist heat technique. Now remember one thing कि autoclave is made up of what? Gun metal और ये two types का होता है. One is the horizontal autoclave and next is what? Vertical autoclave. Horizontal autoclave is used for the large hospital area and for the hospital waste management, and it is used for the small laboratories and small hospitals. ठीक है? And it is made up of what? Autoclave. Now, what are the temperature range? 121 to 134 डिग्री सेल्सियस. अगर अपन 121 डिग्री सेल्सियस अपन यूज कर रहे हैं तो what is the holding time will be 15 minutes and the temperature PSI will be 15 pressure, PSI pressure. If we are using for 134 degrees Celsius, it is just for 3 minutes, 343, and PSI will increase, that is a 30 PSI. And this is used for the disinfection of what? Prions, क्योंकि prions are the most resistant. So prions के लिए अपन use करते हैं. Now, one thing is that we cannot use for the metals because what is the disadvantage that it causes the corrosion. It causes the corrosion and high temperature is there. Therefore, we cannot use for the 2L medias, जो कि क्या होता है LG media for the MTB and the low flow serum slope media for the corynebacterium diphtheria. Low flow serum slope media. Okay, so what is the temperature? That is the 15 minutes for 121 degrees Celsius temperature for 15 minutes. For 15 minutes, all right. And for the hot air technique, for the hot air oven, the temperature is 160 degrees Celsius for 120 minutes. For 120 minutes, उसका एक रेंज होता है, दैट इज 170, 160, 150. वेरी इजी. 170 1 घंटे के लिए, फिर 2 घंटे के लिए, फिर 2.5 घंटे के लिए. ठीक है. दिस इज द हॉट एयर ओवन एंड इट इज व्हाट? हॉट एयर ओवन method is the temperature range I've already told. And what is the biological indicator is what? Bacillus atrophius or Bacillus subtilis and क्या है? And clostridium. Okay, and it is used for what? It is used for powder, sterilization of powder, petroleum jelly जिनके लिए अपन autoclave use नहीं कर सकते, and sharp objects. ठीक है. Coming to the next question, which of the following is most resistant to the sterilization? Cyst, prions, spores, or the virus? So, which of the following is most resistant? So which of the following is most resistant to sterilization? I hope you know this answer, the prions. When we come to the sequence of resistance in decreasing order, it is what? It is what? Prions, then the bacterial spores, then the coccidian oocyst. Okay, and then we have what? Non-enveloped virus. Non-enveloped virus. Then we have the fungus. Then we have the vegetative form of the bacteria, and last is what? Enveloped virus. Okay, so please remember the first two and the last two, that prions are the most resistant, and then the bacterial spores and the enveloped virus and the vegetative form of the bacteria are the least resistant. Now choose the correct ones from the decreasing order of resistance to the sterilization. That is the prions, spores, bacteria, spores, bacteria, prions, bacteria, spores, bacterial spores, prions, bacteria, and the spores, prions, bacteria. So, which of the following is true in the decreasing order? So very easy. इसमें एक या भला ये पी जाएगा क्वेश्चन है, but we know that it is the prions that are most resistant and the bacterial vegetative form. Then the enveloped virus are the least resistant. Now, what is the method of prions disinfection? के क्या क्या method होते हैं? ठीक है, इधर हाईएस्ट, क्योंकि हाईएस्ट रेजिस्टेंट है, सो वी यूज हाईएस्ट टेम्परेचर ऑफ ऑटोक्लेव, दैट इज स्टरलाइजेशन टेक्निक दैट वी यूज 134 डिग्री सेल्सियस टेम्परेचर फॉरवर्ड फॉर 1 आवर बाय ऑटोक्लेव। इसके अलावा वी यूज 0.5% ऑफ हाइपोक्लोराइड आयन सोल्यूशन or 1N 1N sodium hydroxide solution for the disinfection of the prions, and it is the smallest pathogen, smallest non-living organism with no nucleus, that is what pathogenic, ठीक है, smallest pathogen with no nucleic acid, that is what pathogenic to the human, and mostly it shows the CNS manifestation like Kuru's disease, right, and Creutzfeldt-Jacobs disease. All are these are manifestations of the prions. All right. Now, what are the sterilization agents include? It's again a PGI question. That's dry heat, ETO, ether, alcohol, or the chlorhexidine, So, what is a sterilization agent? जब अपन बात करते हैं sterilization की और disinfection की, asepsis and cleaning, or decontamination. There are some basic difference between all these. First, let me know the answer. What are the sterilizing agents that we are included? So take your 10-15 seconds and just let me know what will be the answer. So what is that? What is that? It's what? It's what? It's dry heat and ETO बाकी सब क्या डिसइंफेक्शन मेथड है, ठीक है। स्टरलाइजेशन मतलब SAS स्पोर भी स्टरलाइज, स्पोर भी डिस्ट्रक्शन विद द वेजिटेटिव फॉर्म डिस्ट्रक्शन। डिसइंफेक्शन मीन्स कि ओनली वेजिटेटिव फॉर्म, एंड इट इज ऑफ थ्री टाइप। वन इज द हाई लेवल, one is the intermediate or medium level, and last is the low level. तो तीन तरह के हैं। If the higher concentration of high level of the disinfection is given, it is able to destroy even spores in that case, ठीक है। asepsis का मतलब living tissue को free of pathogen बनाना, किसको, living tissue को। next is the cleaning or the decontamination, that is decreasing the pathogen to a certain level that it is no more pathogenic to us, to humans, without any protective attire. So that is decreasing the concentration of the pathogen is what cleaning. So dry heat, ETO, and the H2O2, aldehydes, plasma sterilization, hot air technique, moist air technique, these all are methods of what the sterilization agents. And ether, alcohol, chlorhexidine is nothing but a form of the alcohol that is found in what, Dettol, सॉरी सेवलॉन, और डेटॉल में अपन को मिलता है दिस क्लोरोएक्सिनॉल, ठीक है, वी फाउंड इन द डेटॉल्स, ठीक है। नाउ नाउ So these are the spongicidal agents, that is I already told you, ethylene oxide we use for what, we use for the fumigation के लिए। और अपन क्या यूज करते हैं, अपन H2O2 भी यूज करते हैं फ्यूमिगेशन के लिए। इसके अलावा ग्लूटरल्डिहाइड, formaldehyde is no more used क्योंकि it is very carcinogenic and toxic, therefore formaldehyde the use is obsolete now, ठीक है। इसके अलावा what are these are the methods of fumigation as well, and the spongicidal ETO, H2O2, aldehydes, and the autoclave हो गया, hot air oven हो गया, and what, and the plasma sterilization technique. These are methods of the sporocidals. Now, comes the next question. Which of the following is true about the pasteurization? That it kills all the bacteria and the spores. It kills all the bacteria except thermodynamic bacteria. It kills 95% of the organisms, and all the bacteria are the destroyed. So, which of the following is true in this case? Which of the following is true? It kills all the bacterial spores. We just read कि pasteurization doesn't kill the spores, doesn't kill the coaxilla, and doesn't kill the prions. ठीक है, तो ये तो वैसे ही wrong हो गया. Now it kills all the bacteria except thermoderic bacteria. What are thermoderic bacteria? Thermoderic bacteria are those bacteria that can grow in varying temperature to a range of the temperature, and they are not killed by pasteurization technique. So this is true. It kills around 97 to 95, 99% of the microorganisms, and all the bacteria are not killed because thermoderic bacteria are not killed. It is a technique of the moist heat sterilization disinfection technique where temperature is kept below 100 degrees Celsius temperature. Along with the pasteurization, vaccine bath is one of the method of less than 100 degrees Celsius temperature. इसके अलावा we just read that incipation the temperature is also what less than 100 degrees Celsius, that is 83 degrees Celsius temperature we use, and for the 3 days consecutive heating is done. Tindelization is 100 degrees Celsius at 100 degrees Celsius is done, and more than 100 degrees Celsius हमने autoclave पढ़ा है, hot air oven पढ़ा है, ठीक है? So they are more than 100 degrees Celsius. So they kill all the vegetative form of the bacteria but not spores and Coxella burnetii and the prions, ठीक है, and kill up to 97 to 99% of the bacteria. We did three methods of the holder flash and the ultra high temperature. Ultra high temperature is the highest temperature, that is 134 degrees Celsius for just for the 2 seconds, just for the 2 seconds, ठीक है. So we are done with today's session. We are done with the today's session. One, with basic definition we covered, and the autoclave we covered, hot air temperature, hot air oven, the temperature range we covered. One thing about the ethylene oxide, remember that 40% of the relative humidity is needed for its action. Okay, and it is used for the fumigation. It's used for the fumigation. Now the work of the ATO depends on the four parameter, that what is the concentration of the gas we are giving about 2 to 2.4% of the ethylene that is up to 700 milligram per liter. ठीक है, just remember 2 to 2.4%, relative humidity of 40%, and the exposure time क्या है इसका, अगर 4 to 5 hour then at temperature 38 degrees Celsius, and for 1 hour it is 55 degrees Celsius temperature range. Advantage क्या है कि high penetration power है इसकी, but what is the disadvantage is that it's carcinogenic, it's toxic, and it's very costly. Another disadvantage there is that aeration is up to 8 to 10 hours. एरेशन क्या होता है, अपन फ्यूमिगेट कर देते हैं ओटी को, उसके बाद जो बची हुई ईटीओ है वो कार्सिनोजेनिक टॉक्सिक है, सो वी नीड टू रिमूव दैट द लेफ्ट ओवर, एंड फॉर दैट वी नीड एरेशन ऑफ 8 to 10 hours which is very time consuming, so cycle क्या होती है लंबी हो जाएगी. Therefore we generally, although it is the best method of fumigation, but itself it has some disadvantage. And what is the indicator for the ETO, what is the indicator is what, Bacillus, Bacillus atrophius और subtilis, या फिर Bacillus globigi. ठीक है, all these are the biological indicator for what, for ETO, for what, for ETO. ठीक है. Okay, we covered the ETO, and we covered the hot air oven, the autoclave, that is important. इसके अलावा एक चीज और रहती है, that is the plasma sterilization. Plasma sterilization is a modified method of modified moist heat technique, that is modified autoclave, that is used for what, emergencies. ठीक है, जैसे कि ओटी चल रहा है और बीच में अपन को इंस्ट्रूमेंट्स और स्टरलाइज करना है, सो वी यूज द प्लाज्मा स्टरलाइजेशन this flash sterilization technique. But what is the disadvantage कि अपन जो instruments use कर रहे हैं, it is in unwrapped condition, therefore उनको बाहर निकालेंगे तो again risk of recontamination is what, very high. ठीक है. One method is the plasma sterilization. ठीक है, 1 method is the plasma sterilization. 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 1 method is the ठीक है. And the plasma sterilization is what we use H2O2 in the electrical field. This will break down in the presence of electron photon. We break down the H2O2 to what hydroxyl ions and hydroperoxyl ions along with the byproducts that are not harmful. ठीक है. So we use the plasma sterilization technique. And what is the biological indicator is similar to that of the autoclave. क्या है वो? Bacillus steothermophilus or geobacillus steothermophilus. ठीक है. And it is also a method of the sterilization. Now some radiation, aldehyde, alcohol, these are alcohol to disinfection में आ जाएगा, but radiation and this aldehydes are still left. And but since we have done the question answers round, that will be covered again in the revision of the microbiology we'll do just before the examination. ठीक है. So that was it for the today's session. Do like, share, and subscribe, and please use my code, that is Muskan10, to get 10% of the discount whether you enroll into an academy, whether you enter the any subscription or any examination all over India, and use my code, that is Muskan10, to get 10% of discount. And do like, share, subscribe, and follow me on the Unacademy app. Follow me on the Unacademy YouTube channel as well as on the Instagram. So I will see you soon and take care. Until then, I hope that you guys are doing well, study well, and take care of your mind, of your health.